Good morning. A warm and heartfelt welcome to each one of you. It is both an honor and a privilege to host you all at this impactful and much-needed event, a social outreach program jointly organized by the Department of Biotechnology and Microbiology and the Department of PG Biotechnology of NMKRV College for Women under the aegis of the Bhavani Memorial Endowment Fund, an alumni-driven initiative with a vision for social impact. We request the guests to take the seats on the dais. Firstly, let us begin this event with the Nada Gite. I request all of you to rise for the Nada Gite. I request you all to maintain silence as you rise. Thank you. Let us seek the blessings of Lord Ganesha with an invocation song by our students.
संततमहं कुञ्जरमुखं शङ्करसुतं तमिह श्रीविघ्नराजं भजे। संततमहं कुञ्जरमुखं शङ्करसुतं तमिह श्रीविघ्नराजं भजे। सन्ततमहं दन्ति सुन्दरमुखम् अन्तकान्तकसुतं तमिह श्रीविघ्नराजं भजे। श्रीविघ्नराजं भजे श्रीविघ्नराजं भजे श्रीविघ्नराजं भजे श्रीविघ्नराजं भजेऽहं भजे तमिह श्रीविघ्नराजं भजे सेवित सुरेन्द्र महनीय गुणशीलम् सेवित सुरेन्द्र महनीय गुणशीलम् जप तप समाधि सुर वरदानुकूलम् आवित सुरमणि घन भक्त परिपालम् भयङ्कर विषङ्गमातङ्ग कुलकालम् श्रीविघ्नराजं भजे श्रीविघ्नराजं भजेऽहं भजे तमिह श्रीविघ्नराजं भजे
Thank you.
Thank you, girls, for rendering such a beautiful song. I now request Professor Priya, HOD Department of Biotechnology and Microbiology, to welcome the guests and the gathering.
Good morning, one and all present here. It's an honor and privilege to welcome the esteemed guests of the day. I heartily welcome Dr. Smita Carol Saldana, Associate Professor, Department of Medical Oncology, Kidwai Institute of Oncology. We welcome you, ma'am. I also extend a warm welcome to Dr. Mustafa, Associate Professor, Department of Oral Oncology, Kidwai Institute of Oncology. We welcome you, sir. It's my great pleasure and honor to welcome Dr. Y. Tulzappa, Retired Professor, Department of Botany, National College, also the father of Mrs. Bhavani. We welcome you, sir. We can just look into their contributions and insights, which will leave us more aware, more empowered, and more prepared through these sessions. I also welcome our beloved principal, Dr. Snehalata G. Nadigar, in her absentia, family of Mrs. Bhavani, all faculty members, the team of doctors from Kidwai Institute of Oncology, and also the technicians, non-teaching staff, general public, and our beloved students. I welcome you all. Thank you.
This event is a social outreach program initiated by the alumni of Department of Biotechnology in the memory of Mrs. Bhavani. I now request Dr. Mrinalini B.R., HOD, Department of PG Biotechnology, to speak a few words about Mrs. Bhavani and the purpose of this event.
Namaste and good morning, everyone. All the distinguished guests on the dais. It is personally a very emotional moment for me because Bhavani was my very close friend. She was my classmate. We studied here together. So we are from the first batch of BSc Biotechnology in NMKRV College, which was from the year 1994 to 97, and it is my privilege that I have an opportunity to serve the institution again here. So if it takes me back to 1994 when we all studied together, And Bhavani was, we were buddies like any of you here, and we went on to do our BSc. And then each one of us took different paths. Some of us did an MSc immediately. So Bhavani also did her MSc in zoology in Bangalore University. And it was also the first year that in Bangalore University MSc Biotechnology had initiated, or it has just started. Some of us took a little break, and then I was working for a company called Cipla, and then I resumed with MSc Biotechnology. However, after which she worked a year in tissue culture lab in the RV Engineering College. And then she was the first one to get married in our group, and we were very excited about that. And then, after marriage, after a few years, she always had this ambition to go abroad and do her further studies. So she did her master's in MS Bioinformatics from Glasgow University, UK. And then came back. And all through, yes, we have shared a lot of our life experiences, a lot of joys, a lot of sorrows together. And then after marriage, yes, we all of us got married. Even I got married, and we had children. So Bhavani had 2 kids. She was a very cheerful, helpful, and a very jolly-go person, which all of us cherish. And sorrowfully, when we learned that she was in the 4th stage of her cancer, all of us were helpless. And it was a very, a very helpless situation. And in fact, only when we lose somebody who is very close to our heart, it pains a lot. And it stays in the memory too. But then life must go on, and it has been going on. And Bhavani's children have grown under the affection of their grandparents and her father, and their father, Mr. Nagaraj, who has not been able to come here today, but then he has made arrangements for a live streaming of this event. I thank Nagaraj for that. So we have Chetana and Aditya. Chetana is doing her 10th standard and in Navodaya school, and Aditya is doing his 8th standard in Sainik School, Mysore. Very proud about the achievements that they have made until now. Yeah, but later on, after she was no more in 2014, so we friends, we thought that we will have to do something for our dear friend, which will also have a social impact. Probably because if she would have been screened earlier, there would be hopes. So we started with this initiative of contributing and coming up with the Endowment fund. And here I must thank the then principal and my beloved teacher, Professor Suman Prasad, who heeded to our request. And she went on to initiate this endowment fund under the great cooperation of Kidwai Memorial Institute of Oncology. We thank them a lot, and they have been with us for almost a decade now, conducting screening camps and bringing about a social initiative and impact. So that is the purpose of Bhavani Memorial Endowment Fund, and we intend to create a social initiative here. And I request all of you to avail the screening facility that is available here, and hope you have informed your mothers and aunts and your neighbors. We have also gone around to the nearby colleges, the police stations, and other shopkeepers as well, in order to spread the word that we are having a screening camp today, and I hope this will be a great success. So thank you all for being here, and make the best use of whatever camp that is being conducted. Thank you.
Thank you, Dr. Mrinali ma'am. I now request the guests to offer Shraddhanjali to Mrs. Bhavani. Thank you. This initiative is made even more meaningful through our partnership with the Kidwai Memorial Institute of Oncology, a government-affiliated regional cancer center recognized by the World Health Organization. Established in 1973, Kidwai has grown into one of India's foremost cancer research and treatment institutions, offering advanced, compassionate, and affordable cancer care while pioneering research and public health outreach. Their presence here today reflects their unwavering commitment to preventive healthcare and community well-being. We are also honored to be joined by representatives from Prameya Health Private Limited, an innovative health and wellness organization dedicated to integrative cancer care. Prameya emphasizes the holistic well-being of individuals by combining modern medicine with evidence-based complementary therapies, mental health support, and lifestyle management. Their holistic model is revolutionizing how we view long-term cancer care and survivorship. Today's program is centered around empowering women with awareness and access through a free breast and cervical cancer screening camp and expert-led talks by highly respected oncologists and health professionals. The screening camp will be open from 10:30 a.m. to 4 p.m. right here at Mangala Mantapa, and the awareness talks will begin shortly from 10 a.m. to 12:30 p.m. Let us remember, cancer doesn't discriminate, and neither should we. With early detection, knowledge, and support, we can save lives and foster hope. Thank you for being part of this meaningful initiative. Let's begin today's program with commitment, compassion, and shared vision to make a difference. Thank you. The awareness talk session is going to begin now. Thank you. Yes, it's there now.
Okay, so will I be able to operate it?
They will be operating today. It's the same. Remote we have.
Girls can keep it together. Introduction is sufficient.
Yes, ma'am. Our first speaker is Dr. Smita Carol Saldana. I request Jaisai Lakshmi of 3rd year BSc to introduce the speaker.
Good morning, everyone. Dr. Smita Carol Saldana is an accomplished medical oncologist and associate professor at Department of Medical Oncology and Bone Marrow Transplantation at Kidwai Memorial Institute of Oncology, Bangalore. With over 15 years of experience in oncology, she specializes in management of lymphomas, leukemias, adult bone marrow transplants, breast cancer, and ovarian cancer. Dr. Saldana completed her DM in medical oncology from Kidwai Institute, following an MD in internal medicine from Father Muller Medical College and an MBBS from K.S. Hegde Medical Academy. She further earned her expertise through a prestigious fellowship in bone marrow transplantation and multiple advanced international preceptorships under European Society of Medical Oncology. She has led and contributed to numerous clinical studies, including ongoing research on diffuse large B-cell lymphoma. With over 30 publications in reputed journals, Dr. Saldana has presented her work at global conferences, including ESMO Congress, IASLC, WCLC, and EACR. Her accolades include several gold medals during her academic years, the Pfizer Research Grant, and multiple travel and poster awards at national and international conferences. She has performed or assisted in over 150 bone marrow transplants encompassing autologous, allogenic, and haploidentical procedures. Renowned for her clinical acumen and academic rigor, Dr. Saldhana brings a blend of research excellence, hands-on clinical experience, and a deep commitment to cancer care, making her a valued speaker and a contributor in the field of oncology. I now invite Dr. Smitha Carol Saldhana for her talk.
It's okay if it's not possible, no issues. Yeah, good morning, and I am privileged to be here to interact with such a wonderful youngster crowd and all the girls in the prime age. You all are the future of tomorrow, and I think it's a wonderful gesture organized by Dr. Tyagarajan, Mrs. Bharati's father, awareness and giving this screening of cancer in the general population. I think that's something which is lacking tremendously in our this era, and I think definitely it's a wonderful gesture. If it's not possible, it's okay. Yeah, sufficient. So my apologies that the topic was told to me was lung cancer. Therefore, specifically, I have brought a focus slide on lung cancer. But when I came to know that it's basically a women's college, and I think I need to touch upon certain aspects of breast cancer, cervical cancer, which is very important in the present era. So I think we'll keep it a very open session where it's going to be a question answer. Rather than me going on talking, I would like you all to come out with what doubts you have, what questions you have, what problems you face, and what solutions we can give, or what are the right facts. There'll be many myths in your mind which you can feel free to discuss, open up and ask, and we can try to solve those questions. So, lung cancer, I think why the moment you hear the word cancer, everybody's life changes. And in the recent, we see the cancer disease is increasing tremendously. So by 2040, we say the number of cancer cases will double from what it is now. At present itself, if you ask every household or every family, there would be somebody who is a cancer survivor, or somebody who has been diagnosed with cancer and undergoing treatment, or who has succumbed to the disease. Many people ask me, why is it that cancer incidence has increased so much in the recent times? Why do you see so many numbers of cancer? So I work at a regional cancer center called Kidwai Memorial Institute of Oncology, which is a referral center and a regional cancer center. So we roughly see around 300 to 350 patients in our department itself, medical oncology. And we see them in various stages of cancer. And many of them ask me, like many of my colleagues, many of my friends from the other professions ask me, don't you feel depressed working in a cancer hospital? I would like to say, I don't feel depressed, because we do a lot of life-saving and life-changing treatment in our center. Agreed, in cancer, everything we cannot cure or everything cannot be treated. But multiple diseases, specifically something like lung cancer, even in stage 4, they have a very good quality of life just with the oral tablet, and they survive for more than 5 to 7 to 10 years in stage 4 cancer. I think that is something which is the advancement of science. We cannot say the same thing for all types of cancer, but breast cancer, lung cancer, many lymphomas, many leukemias, the treatment has advanced to a great level. Yeah, but the thing is, it has its own financial implications. Now, why is screening important, or why this education talk is important for you? Can we do something to prevent the development of cancer? That is where all of you young people come in. there's something called as primordial prevention, which means you prevent before it develops itself. So you eliminate the risk factors. What are the risk factors? Next is something called as primary prevention. You're already exposed to the risk factor. What can you do to reduce the risk from this particular risk factor and prevent the disease? Secondary prevention is when already the disease has set in and then you're trying to prevent it. So we are not focusing more on secondary or tertiary prevention. I'm trying to focus more on the primordial or primary prevention. What you can do at this juncture which will help in preventing the development of cancer. If you look at lung cancer, it is the leading cause of cancer. So for your information, in urban Bangalore, lung cancer is the leading cause of cancer in mortality and morbidity in the men, and breast cancer is the leading cause of cancer in women, both in mortality and morbidity. If you look at the rural population, women, cervical cancer is one of the leading causes. Now lung cancer, I said men, but in women it's also catching up very fast. We see our lifestyle has changed tremendously. You see a lot of girls, due to various reasons, smoking. And that is one of the most important risk factor for the development of lung cancer. So tobacco. It's not only for lung cancer. Tobacco can cause more than 19 to 30 types of different cancers. So, if anybody of your friends, any one of you all are smoking, please give it up. Whatever happened. From henceforth, if you give up, definitely you become, after 5 to 10 years, a never smoker. So, I'm telling you because lung cancer was the leading cause in men, but it is becoming the leading cancer in females as well in the urban population. So if you look at lung cancer per se, almost every year you see more than 2.2 million new cases and almost 1.8 million deaths. It's a huge number. And usually we used to say that this disease is more of the elderly, above the age of 60 or 70 years. But nowadays we're seeing patients coming to you in 40s, 50s with lung cancer in the advanced stage. Again, what happens if you are advanced stage? The chances of cure comes down. You are supposed to be on treatment for a longer duration. And look at the last statement. Higher incidence in men, but rising rates in women. That is why this awareness talk is important. Now this is the Globocon data which tells you roughly which are the top 5 frequent cancers. So in males it shows lung, prostate, colorectal, stomach and liver. In women it shows you breast, lung, colorectal, cervix and thyroid. If you put both together, lung is the most common, followed by breast, colorectal, prostate, stomach and also head and neck. Head and neck is something which has been missed over here. So head and neck, Dr. Mustafa will be talking. That is also another leading cause of top 3 to 5 cancers. Now if you look at the lung cancer, we see the increased trend in the urban population. Why urban population increased trend? Because of our lifestyle changes, our whatever the habits what we have. And the risk factor, the most important risk factor is high prevalence of tobacco use. The second thing is environmental pollutants like your indoor air pollution or the outdoor. We have the environmental air pollution which is not under our control, but the tobacco use definitely is under each one's control, which you can avoid. So in lung cancer, the most important types are non-small we say and small cell. In non-small cell we have adenocarcinoma, we have squamous cell carcinoma we say. These are the histological types. So from which cell it comes. So I'll not go into details of this. But the most common type is non-small cell lung cancer. Almost around 70% will be non-small cell. Around 20 to 25% will be small cell lung cancer. Now how will they present to you? So usually it may be somebody with a history of smoking for more than 10 to 15 years. Now just occasionally smoking one cigarette does not make any problem. But what happens routine, a chain smoker, if you're having more than consumption of 5 to 10 cigarettes per day, It may be smokeless tobacco or it may be smoked tobacco. It may be e-cigarettes also. So don't be under the myth that e-cigarettes are safe. E-cigarettes are not safe. They are more harmful than your regular cigarettes, filtered cigarettes. So what happens is when you are inhaling the compound, the nitrosamines, which causes the carcinogen, we say, it goes deeper, and so you have more of central lesions, more of different kinds of histological types of cancers. They can present to you with unexplained cough for a long duration, weight loss, blood in sputum. So sometimes you may see somebody having, while coughing, a blood in sputum. That is called hemoptysis. They may have sudden onset of breathing difficulty. And in case it is gone to an advanced stage, they may have chest pain, they may have difficulty speaking, they may have change in voice. If it has spread to the bone, they may have other bony pains, other features. Sometimes they can have other paraneoplastic features. The most important symptom will be weight loss and fatigue. Rarely you can also see fever. Now, how does tobacco smoking cause the cancer? Now, this is very important for all of you young people here. So, look at the approximately 85 to 90% of cases is because of tobacco. Not that we see a lot of instances where somebody who's a teetotaler, somebody with no bad habits still comes with lung cancer. That may be because of genetic factors, or maybe because of environmental pollutants, or certain times because of occupational exposure like asbestosis or certain other mesothelioma, we say, where it can be because of their occupation. But most of the time, if you are a smoker, if you have used tobacco, that is the most important cause. And what happens is there's something called as carcinogens present in this tobacco smoke. So you can be a primary smoker or you may be a secondary smoker. Your friend may be smoking and you are in that environment. You're always inhaling the smoke of your friend. That also is harmful for you. At home, your parents may be smoking and you are sitting in that same room or your car. That also, it's called second-hand smoke. That also is harmful. So it need not be that you are the primary smoker. Even if you are exposed to this smoke, you can develop these particular changes. And the second-hand smoke increases the risk by approximately 24%. I already mentioned to you, tobacco can cause more than 30 types of cancer. Name the cancer. One of the risk factors will be smoking. The second risk factor is alcohol. In the present era, I see a lot of college students or a lot of youngsters. There's a lot of usage of alcohol in various forms and a lot of usage of smoking in the girls. This is something which we can definitely avoid. Various reasons. I know one thing is maybe because of peer pressure, you're going for a social party along with your group, you need. Once in a while, everything is fine. Regularly, definitely no. And earlier days, they used to say alcohol less than, like wine, less than 30 ml is healthy. The present WHO says any amount of alcohol is a carcinogen, and it's a grade 3 carcinogen. Means it will definitely cause the risk of cancer being increased. It is anyway got other aspects. It can cause liver damage, various other factors are there. But the incidence of cancer definitely increases. The second thing is processed food. Again, the intake of processed food, high red meat, has increased in the entire present era. So again, the increase of processed food is also another, like sausages, your salami, various burgers, where you are using processed meat. Again, which is kept preserved and kept for a long duration. That is also another grade 3 carcinogen. Next, we have environmental, other occupational exposures like asbestos, radon, arsenic, cadmium, chromium. These are all with your industrial exposure, occupational exposure, and people working in mining, construction and manufacturing industries. Now, family history, if you have a first degree relative. So what do you mean by first degree relative? Your immediate sibling, a brother or sister, your parent. Then it is a first degree relative. If they have they had a history of cancer, then you have a very high twofold increased risk. your cousin, your uncle, your aunt, that does not mean a first degree relative. Then the chance of cancer is much less. So if you have a first degree relative, that is either your offsprings, your children, or your siblings, or your parents. If these have a history of cancer, you require to go for definitely a high risk cancer screening. There can be various mutations, we say, which causes the cancer. We have EGFR mutation, we say KRAS mutation, AL cross. So these are all the advancement of therapies what we have now. Now we have found out what are the driver mutations which drives this lung cancer, and we can target this cancer as per the particular mutation. Other risk factors, if they have chronic lung disease like COPD, that is old history of tuberculosis, and they have a long history of breathing difficulty, history of tuberculosis, HIV, that is again human immunodeficiency virus. If you have a immunodeficiency virus infected state, the chance of developing cancers again is a much higher proportion. If you're immunocompromised because of any reason, maybe post-transplant, maybe post-HIV infection, or you have an immunodeficiency disease, again the chance of developing cancers are high. These factors we cannot change much. Like if already you have a disease, if you already have a genetic mutation, we cannot change it. You are born with it, you have to live with it. Only thing is, you can go for an early screening. But lifestyle factors is something which we all can change. We can all modify. And this is called the modifiable factors, which each one of you need to address. Which each one of you need to definitely look at and practice to avoid these factors. So in diet, I already told you, having a very high processed meat, red meat, alcohol, smoking, a very high calorie food, all these are definitely causes for cancer. Physical inactivity, obesity, again these are factors for cancer. In women, I will touch on over here specifically, nulliparity, late marriage, your age at menarche very young age, and menopause at a later age. So the amount of your reproductive age group exposure to estrogen is much higher. The chances of breast cancer definitely increases in such individuals. Again, people who have a late marriage and late childbirth after the age of 30 years, it is told as one of the risk factors for developing breast cancer. People who are nulliparous, people who do not breastfeed, again these are risk factors for breast cancer. I am telling this because all of you are ladies over here who are going to be future, having a family, going to be mothers. So I'm just trying to emphasize the fact why it is important to have a healthy and a good family life. It is important to breastfeed the child because lactation does prevent breast cancer to some extent. Next, these are the other mechanisms. I will not talk on this. Pathogenesis, I think we don't require to go on this. Let's go to prevention strategies. So what can we do? For lung cancer specifically, smoking cessation. If somebody is addicted to smoking already, there is something called as smoking cessation methods. So there is called as nicotine replacement therapy. Now nicotine in the smoke, tobacco is the most important thing which causes this addiction. So you have nicotine gums which can be used, and there are various behavioral therapies to help you come over this nicotine addiction. Then counseling. You go to a regular counselor for counseling, and there are certain other drugs which we give pharmacotherapy to help you get over the addiction. Then the policy measures which is coming at a higher level, at the national level or the international level, where they advise tobacco taxation, advertising bans, smoke-free laws, and public education. So this is what we are doing, public education. Awareness camps on the risk of smoking. If I educate you today, you will go and educate your friends, your home people, your brothers, your sisters, and therefore the education passes on. Whatever I'm speaking here does not get limited to this room itself. You need to go and tell your friends, you need to go and tell back your home members, your mother, your father. If you have a smoker in your house, you need to go back and tell. You're not only putting yourself at risk, you're also putting my life at risk. Got it? So that is where your role is important. Secondary prevention is already you have a smoker in your house. Somebody who has smoked for more than 15 or 20 years. They need to go something called as a screening test. And what do we do a screening test? It's not a simple chest X-ray. So during the COVID era, when there was COVID, because COVID involved the lung, a lot of people underwent CT scans. And when they underwent CT scans for COVID, looking at the lung infection, multiple people found out early cancer, lung cancer. Because the screening test is a low dose CT scan which is done annually for people who are high risk above the age of 50 years. You and me, right now, we don't need to go a CT scan. If you are above the age of 50 years, if you have smoked for more than 15 to 20 pack years, then you require to get a low dose CT scan. So don't think for everything we have some test which will detect if any cancer is there. There's no test like that at present. The screening is there for lung cancer, low dose CT. You have breast cancer, you have mammography and the ultrasound mammography and your screening, breast cancer screening, which helps in preventing the early, diagnosing cancer early. For prostate in men, you have the prostate cancer PSA levels. And a regular annual examination of the other cervical cancer, you have pap smear, which helps in screening and detecting these cancers early. All cancers cannot be detected regularly. Okay. So there the role comes in that you have a healthy lifestyle, prevent factors which causes the cancer. Now with this, it is recommended only for high risk individuals. It helps in early detection, but the other problem is it can sometimes overdiagnose. It can have false positives, and if you have a false positive, the mental stress that person goes through is tremendous. So that is why it's not recommended for everyone. Now this is the screening guidelines. Age above 55 to 77 years, more than 30 pack years, and current smokers who have quit within 15 years. But the most important thing is smoking cessation. So I'll just touch upon breast cancer screening. How many of you know what is breast cancer screening? What are the methods? I want it to be a question answer session, so I want you all to ask me some questions. How many of you all know breast cancer screening? Raise your hands. Nobody knows? I can see only one hand. You all are educated people right in the heart of city. You are having an awareness camp from last 10 years. If you do not say you do not know, then I feel sad. 1, 2, that's it. 3. Be bold. There's nothing to be shy of about it. You know or do not know? Breast cancer screening, know or do not know? Do not know. Okay. Somebody who knows, are you bold enough to tell me something? What you know? Can you tell me? Yeah, please. So I would like it to be a question answer session where you can ask me questions which I can address.
You basically check whether there's any kind of lump formation. Yes. Either ways when you must see. Okay, good. And any idea when do you do it? You do it only one time or you keep doing it routinely? Routinely.
Okay. So very good. Your good name?
Karishma Hoysala.
Yeah, very good, Karishma. Anybody else would like to say something about it? So I will touch on breast cancer screening because all of you are ladies here. All of you will go back and teach your parents, your mother at home, your aunt at home or your sister at home. And that is how the awareness grows. So how is breast cancer screening done? Is a simple thing is we say clinical, one is clinical examination. Clinical examination is done by a doctor. But before that there's something called as self-breast examination. What? Self-breast examination. It is to be done by each individual by yourself. So you should know what is normal for you first. So what you need to do is you go back home today. When you're having a bath, look at yourself in the mirror. Identify both your breasts. See if they are both equal at the equal position. Usually one breast will be slightly fuller compared to the other breast. That is normal, slightly. But basically you need to look at yourself in 3 different positions. One, your hands at the waist. One's hand raised above. One's hands raised above straight. On your shoulder, head over here, so raise straight and at your hip. You need to look at your breast, both your breast. So first you should know what is normal for you to know what is abnormal. Without knowing what is normal, you cannot make out what is abnormal. So many a time what happens, you see a simple
a little, maybe something, a little swelling, you get panicky. We see a lot of people coming, youngsters coming, fully worried, would not have slept the entire night. So that is not required, because you need to know what is normal. You look at yourself in the mirror. Usually the ideal time is 5 to 7 days after the last menstrual period. So if your last menstrual period is the first day of your menstrual cycle, so from then, the 5th or the 7th day, you need to do this procedure. You look at yourself, see if both the nipples, both the breasts look almost equal. Look at even the armpit and the neck, supraclavicular area, just the space above your clavicle area. So these are the important factors what you need to look at. Then you look if you can see any abnormal fullness, any particular swelling. If you see one breast is looking a little more bulkier compared to the other, you see some kind of a swelling. Then you look at your hands down, this position, and the hands raised up position. Sometimes what happens if it's something behind your nipple, in this position it may look normal, but when you are putting your hands up, it may become more prominent. So therefore, this particular 3 levels are told. First is, this is called inspection, just you're looking at it in the mirror. Next, you take the flat of your palm. So if this is your palm, in this method, you take the fingers. The pulp of the fingers is supposed to be very sensitive. With that, in a circular fashion, you need to feel it and see if you can feel any lumps. Normally in this age group, all of you will feel some kind of a cystic or a sac-like feeling, which is normal. And this specifically just before your menstrual cycle or just 15 to 20 days after ovulation it happens, that is normal. That is something like a sack of grapes. If you feel like that, you will feel. That is normal. If you feel something very hard, that is abnormal. Now how do you make out what is hard? This is hard. When you're touching your bone, the temporal bone over here, your forehead, if it feels like this, it is hard. If it feels like your tip of your nose, that is something called as firm. Your lips are soft. Soft is usually not malignant or not cancerous. Even the firm is usually not malignant or not cancerous. If it feels like this, definitely it is significant. You need to go to the doctor and get it examined. Next, just because you have a small lump does not mean it's cancer. But if you feel anything which is not there the previous month and the next month you feel it, definitely please go to the nearby doctor. It may be your physician, it may be your gynecologist, or anybody who is close by, and get it examined. And then you can come to the oncologist for the mammography and the ultrasound mammography. Am I clear? Next, you also need to look at the armpit. Sometimes you may only have a lymph nodal swelling in the armpit or in your supraclavicular fossa over here, just above the clavicle. If any of these areas you feel any hard swelling, need to go and get it examined. Even a firm swelling sometimes can be cancerous, so this you need to go and get examined. If it's something very soft, cystic, usually it is something called as fibrocystic disease, which is common in this age group. Nothing to worry. I hope all of you are clear with it. I want you to go back and tell your mother at home, your sister at home, or whoever, your aunt at home, whoever is there, and need to do it. It has to be done every month, regularly. The date I told you already, 5th to 7th day after your last menstrual period. If you first know what is normal, then there is no situation of being panicking and getting worried about it. And if you detect something, it will be detected at much earlier stage where it is completely cured. It's good for the patient, good for the society, good for the doctor who is treating. Because if it's early disease, it can be cured completely. Fine? Next, cervical cancer screening. Anybody knows what is cervical cancer screening? I think they are doing it over here also. So can somebody tell me? Yeah, please.
It's caused by the human papilloma virus, and symptoms are like irregular periods and continuous bleeding.
And anything is there for preventing that? Any specific thing is there?
There is a vaccine that girls need to take between the age group of 16 to 25.
And how do you screen? Anything about the screening you have heard?
Not much.
Okay, fine. Very good. What's your good name, ma?
Hemashri.
Yeah, very good. Hemashri, a big clap to her. So cervical cancer again is a disease of the women. It is more commonly seen in the rural population. Not that it is not seen in the urban population, but it is more seenly in the rural population. Now again, cervical cancer is a leading cause for mortality and morbidity. Mortality means death. Morbidity means lot of factors. They have lot of health issues because of the cervical cancer. It can be simply prevented. What is the cause? Most important cause, as she mentioned, is HPV virus. So human papilloma virus. Now, it is not the only cause, but the most important cause. So more than 92 to 95% of the cervical cancer is because of HPV infection. Now, how does HPV come? Human papilloma virus come? It comes through your male partner or through the sexual contact, various routes of sexual intercourse we say, and usually it's a commensal of the genital area. So that HPV virus, if it gets infected over a long duration, if you're getting infected today doesn't mean tomorrow only you'll have cancer. More than 10 to 15 years later, the cancer can develop. Now, it need not be that the lady is harboring the HPV virus. It comes from the male partner. So there's something called as HPV prevention vaccine, which is available now and it is routinely now prescribed. So we have HPV-9 and HPV-4 vaccine. It gives you protection against more than 92 to 93% of the HPV types which causes the cancer. It is not 100% giving you protection, but majority of the types which causes cancer it protects. And it is a 2 doses if you are taking between the age of 9 to 14 years for all girls. If it's above 14 years, I'm thinking all of you are above 14 years obviously. So if you all are taking, you require to take 3 doses. But it is still beneficial and it is important you take it. So in fact, I think you can, in organization with Kidwai, you all can plan for a cervical cancer vaccination schedule over here. Because Kidwai being a government center, we get it at a very regional, very marginalized cost, which will benefit the entire population. And you can conduct a camp over here wherein the vaccination can happen. So for all above 15 years, it is 3 doses. Anybody between 9 to 14 years, it is 2 doses. And it is given at a gap of 0, 2 and 6 months. So it protects you definitely against more than 93 to 94 types of infection caused by HPV. So therefore it is recommended and better to give it in the present era. Second thing is how you screen for it, somebody who has already developed or how to check for it. Above 40-45 years, we recommend something called as pap smear. It's a simple smear which is taken from the cervical area. And that will be looking under the microscope and looking if there is any kind of infection, any kinds of changes are there which suggest there are changes looking for malignancy. And the simple screening test which is done, there's also called as something called as the acetic acid test. These both are done to look for cervical cancer detection. Fine. Anything else? Anybody has any doubts? We can just address it. Some myth you have, some doubt you have, you can ask me. Head and neck, Dr. Mustafa will be talking, so I'm not talking on oral cancers. Anything related to other things, you can ask me.
Ma'am, my doubt is regarding the breast cancer self-analysis thing.
Can this vaccine be given to the males?
Very good question, sir. So it can be given to males also. Again, in males, how it helps is, it prevents the spread from you to your partner tomorrow. That is how it prevents. It is not going to be beneficial for you. Other things, HPV can also cause sexually transmitted disease like warts, we say, genital warts. So it can give prevention against that. Also, from that, your male partner, the chances of spread to the female is prevented. We are not recommending it regularly for males because it's an expensive drug and in the Indian vaccination schedule, we recommend only what was cost effective. So therefore, it is told for the females, girls between 9 to 14 years. It is told to be given why 9 to 14 years is before your first sexual contact. Sorry, what was the question? I missed it.
Yes, ma'am. So mine was regarding the self-analysis of breast cancer. You told that the test, whatever we do, can be done from 5 to 7 days after the period, first day of period. What about women who have already reached menopause? How can they test for
So they can just do it at any point of time, and every month they can routinely do it. So usually what happens is, in the reproductive age group, when you are in the menstrual cycles, when you're having the estrogen and the progesterone hormone levels having these hormonal changes, there will be certain changes in the breast because of the hormones. So therefore, to know what is normal, usually we say during the menstrual cycle, when ovulation, the progesterone level goes up, and then you have estrogen levels going up.
Yes.
So there will be breast changes depending on the hormones. So therefore, for the young age group, reproductive age group, we say between 5th to 7th day post your last menstrual period. For menopause women, it can be any particular day, and you can just serially do it on that particular day. You can take it as the 10th of every month, and you can do it.
Right. Okay. Thank you, ma'am.
Ma'am, my doubt is, ma'am, if a pregnant lady is diagnosed with cancer, ma'am, is there a chance that the child is also can be diagnosed with cancer? And also, I had a doubt is, what are the chances of survival of the child?
See, if a woman after pregnancy as such, there are certain cancers which can increase. Okay, specifically. Now, because the woman is having a cancer does not mean that will spread to the child. Like breast cancer will not spread to the child from the mother. If it is a genetic, there are specific genetic mutations we say. All of you would have heard something called as BRCA mutation. I don't know if you have heard. Jolie effect, Angelina Jolie, all of you all know. Who is she? Actress, yeah. So why she became very she's famous. Okay, there was something called as one Jolie effect. So what happened is, somewhere I think 5 or 8 years down the line, a mother was detected with breast cancer. And then they did the mutation, and a mother had this BRCA1 or BRCA2 mutation. And then Angelina Jolie went for her examination. She underwent a risk reduction mastectomy and the bilateral oophorectomy. That is, both the ovaries were removed and both the breasts were removed. Because if a BRCA mutation carrier, the chances of breast cancer and ovarian cancer increases very high, more than 15 to 20%. So therefore she underwent a risk reduction surgery. And then suddenly you had a lot of people coming and asking you about this BRCA mutation. So that was called Jolie effect. Because Angelina Jolie did it, she's a famous personality. It came in the papers, it came in media, everybody became aware of it and they asked. So if they have this kind of BRCA mutation, specifically seen in something called as triple negative breast cancer, then that can be passed on to the offsprings. It's an autosomal dominant we say. So 1 in 4 children can develop it. But if a mother has during pregnancy cancer, does not mean the child will definitely have it. Again, we have various methods to check for it, so we'll advise accordingly and get it detected. But definitely the risk is higher compared to a normal population for that particular child.
Thank you, ma'am.
But with cancer also, both the child and the mother can be having an uneventful and successful life they can have. The pregnancy can go on depending on what stage of the cancer it is, and the mother can also be treated depending on the type of cancer and the stage. Okay, I think if other things are there, we'll continue with the next session. Any more questions? Anything? Yeah.
Thank you, ma'am, for this very informative and insightful talk. You helped us understand the symptoms of breast and cervical cancer. Thank you. Thank you, ma'am. We now move on to the second speaker. I request Shruti Shri, PG student, to come and introduce Dr. Mustafa. Thank you.
Good morning, everyone.
Dr. Mustafa is a highly skilled oral and maxillofacial surgeon with a strong academic and clinical background in oncology. He holds a BDS and MDS in oral and maxillofacial surgery, followed by a specialized fellowship in oral oncology. Since 2018, he has been serving at the Kidwai Memorial Institute of Oncology, Bengaluru, one of the premier regional cancer centers in India. With a deep commitment to community service, Dr. Mustafa has also been actively associated with several NGOs across India, offering cancer screening, education and surgical care to underserved population. His outreach efforts are a reflection of his life's motto: serving humanity is serving God. Known for his compassionate care and dedication to his patients, Dr. Mustafa is also a passionate educator and advocate for cancer awareness. He regularly participates in public health talks and medical forums where he emphasizes the importance of early detection, preventive care, and access to treatment. We are honored to have Dr. Mustafa join us today to share his expertise and insights on oral cancer and the importance of community-level awareness in saving lives. We welcome you, sir.
I must say good afternoon, students, respected panelists, and thank you for giving me the opportunity to speak on a very special occasion where we are commemorating Ms. Bhavani. It's a very amazing initiative from the college perspective and her friends and family members that this day has been being commemorated since 10 years. And so basically ma'am has covered almost every aspect, but just a little small talk on oral cancer from my side. Regarding oral cancer, when compared to the other cancers, what we see in the hospital, the worst part of oral cancer is, well, I'll come to the stage where I'll tell you how it comes in prevention. But the main problem with oral cancer is, I can say, that the cancers which are of the rest of the body, apart from oral cancers and head and neck cancers, are can be hidden underneath the clothes, and patients are not so what can you say, self-aware, and they are a little more confident in the social interaction. But when you come to a oral patient with an oral cancer patient, it is very saddening when basically the appearance of the patient changes. Now we have a few prominent names, one of the politician also, that we can see that how the face is completely changed. So similarly, the person actually completely changes. So first and foremost, oral cancer can directly be correlated to your special senses. One is speech, one is ability to taste, and then deglutination as in eating food. The quality of life really comes down and really affects the individual and the family and friends around them. So first and foremost to start with is small, as ma'am has spoken about various other cancers, I'll talk about oral cancer. First and foremost, what I can say is, and about other cancers, that cancer is much more better in prevention than in going for a treatment. So basically is, as ma'am said about self-examination, about breast, so there is something you can say is examination, oral health examination of yourself. Like we brush our teeth every day, 2 times a day, but what we don't do is we don't, self-examine our mouth. So basically, when it is very necessary to seek help from a dentist as soon as possible if you see any types of white patches, red patches, or any other type of discoloration. So mostly you guys, whoever are going for exams, you must be, due to stress, must be getting small types of ulcers in the mouth. It is called as stress ulcers. But similar type of ulcers, when they come up without any reason and they persist for more than 3 weeks, they are subject to, or they are suspected of being cancerous. So, and coming to oral cancers, the incidence of oral cancer in the world is number 6, as ma'am said, lung cancer, colorectal cancers, and rest. And so oral cancer is number 6 throughout the world. But 1/3 of the cancer, total number of cancer cases, the burden is on India. So just imagine how much cancer diseases are there in India only when compared to rest of the world. So majority you will find oral cancer cases in a certain type of working class, usually who deal with everyday lower income category people usually use this type of tobacco, chewing tobacco, or smoking or non-smoking, I can say. So as incidence of cancer we can actually point out and say that these are the risk factors. There, as ma'am said, red meat, smoking, alcohol, and all that, so on and so forth. So in oral cancers, we can actually point out and say certain specific cancers are 100% the cause of cancers. For example, and in the Indian civilization, since before, as you say, madam has mentioned that women have started smoking. But if you go to rural areas of India or the previous era of our families, eating pan and tobacco goes in our culture. It is not that it has a social taboo. Now, because smoking had a social taboo and now it is becoming common. But the usage of tobacco has been there since the beginning, whether it is smokeless or smoking tobacco. But the usage of tobacco has been there. It is not that you cannot dismiss saying that this population is only having a certain way of consuming tobacco. Apart from that, there's been a study in 2016 that the buccal cancers, the buccal type of cancers, usually happen because of areca nut, and tobacco acts as a catalyst in these type of cancers where buccal cancer occurs. In betel nut, we know that we have slate lime in it, and we have areca nut in it, we have tobacco in it. So we know the ingredients of the pan which definitely causes cancer. So as madam had told, we all are educated class of people here in the society, and it is our responsibility to take the message forward, and as ma'am had said, spread it in between our families, friends, and people who we come across. If you see anybody having pan or anything of that sort, definitely please tell them not to have it. But they will have their own excuses, but being persistent on your loved ones, definitely one day it will make a difference and make them stop. So this is one carry-home message for this thing, all you students here. And as madam, and another thing, whenever you have a dental problem, whether it be infected tooth, cavity, caries teeth, sharp-edged tooth, or anything of that sort, it is so disheartening to see patients walk into the dental office or our OPD with a cancer on the gums or on the cheek or on the tongue just because they were having a sharp tooth end, which could have been resolved by going to a dentist just some time back when they had a fractured tooth. That's it. But unfortunately, due to ignorance, that has turned into cancer. I'll walk you through patients. I'll just I'll just walk you through the patients who undergo or who get oral cancer. So to start with, a patient comes into the OPD. For example, they have a cancer in the gum. So patient comes in with family, wife, husband, mother's daughter, somebody. It's very disheartening. And age-related, actually, in young people who get cancers, actually it is very aggressive when compared to cancers in adults. So they come in as soon as we see the lesion, doctors, because as we see so many patients, we tend to know that, okay, this looks like a cancer. But when you ask the patient for a biopsy, it really jolts the patient and the family members like for a biopsy. But when the biopsy is done and the results are being given, then just imagine this is how you're going through with your family and friends or yourself or anybody. Because I have to scare you because it can happen to anybody. It's not just, it can happen to me also. So cancer, as madam said, it does not discriminate. It can happen to anybody. So when the biopsy results come as positive, that's like a judgment day. That's really, really bad and sad. To inform anybody, for us to inform the patient that you have cancer, we actually take a toll, because seeing the expressions on the family and friends, it makes a lot of a difference. But then, what type of surgery is going to be done? That's another trauma. For example, they have tongue cancer. I'll walk you through. If the patient had a sharp edge on the tooth, on the side of the tongue, and when they come to know about it, okay, there's a cancer on tongue, so we'll have to cut a part of the tongue, and that can be half of the tongue also. Okay, for example, and if it is a big cancer which is very aggressive, and if it has crossed the midline, we have to completely cut I have to scare you, because this is the time where I have to put awareness, so that I have to tell you with love and scaring you as well that how it works. So when patient, the tongue is involved, and then post-op, what happens is patient cannot talk properly, patient cannot speak, taste the food properly, patient cannot swallow the food properly, and then they'll have to use a pipe. And it is not that I've seen this only in old patients, I've seen this in young patients also. 17, 18, 21, Kabaddi national players, that means they never had anything, but they used to have gutka only. I'm just telling you, like athletes also, it's not like physically fit, but they don't have, but they had a habit. As coming to smoking, as madam said, primary smoking, secondary smoking, there's something called as tertiary smoking also. Tertiary smoking is in a place where smoking is being done regularly. For example, inside a car. Even if somebody is not smoking inside a car, at the time you are sitting, but there is regular smoking in the car. That is called tertiary smoking, and that means you are still inhaling carbon. Anything black is dangerous. So you're inhaling carbon. So the take-home message is basically you have to be. So number one is self-examination of your mouth. Whether you're having burning sensation, whether you're having discoloration, whether you're having dryness of your mouth. So these are things what you should keep in mind, and you should get yourself treated with any dental problem as soon as possible. And you should not, as in Indian population, we really ignore dental problems. Like we say, you should have a general medical checkup every year. you should also have a regular dental checkup every year, because oral health starts from the mouth. Because you must have heard in earlier days, doctors used to just see the tongue and say what the disease is. So there's a small thing I'll tell you. In medical terminology, anything is really what we call the tongue is gloss. Glossitis, hemiglossectomy, complete glossectomy. It is called as gloss, which is derived from the word glass. So it directly represents your health. General body health is reflected on your tongue. So basically, you have to take good examination and good care of your oral health. Then only probably you will not have. As Madam also spoke about HPV. HPV infection is also oral cancer is also caused due to HPV infection. So as cervical in HPV causes virus causes cervical cancer, similarly it causes oral cancer as well. So I hope all of you start doing the self-examination properly for yourself and try to tell your family, friends, and whoever you see come across having gutka or the areca nut, supari, is such a basic thing. If you tell anybody that you should not be eating supari, they'll be like, this is just supari. But no, it is a thing which causes cancer. Definitely causes cancer. And people who eat supari eat it very regularly. They can't stay. So what happens when you tell patients, you need to stop eating, you should stop and all that. They say it's difficult, we can't work. They have their own excuses. But what happens when a problem occurs, when they get a lesion, when they get an ulcer, immediately they stop. Now where did that will come from? It has to come, they have the will. But just that when they leave it, after they get a problem. So please, nothing is impossible. If anybody who has a habit of something, you should cessate and stop, because hearing about cancer is not so difficult and dangerous. But if you are going through it, or any of your family members going through it, trust me, it is very bad and it is not good. So please, as we are commemorating this day for our late Miss Bhavani, and see, one person has made an impact since 10 years, that such good friends, colleagues, family like, they're taking such initiative. This is all for the future generation. This is not anything. This is not with anything with regard to the present generation or anything of that sort. This is for the future generation as well, and the people whole and around you. Okay, thank you so much.
We thank you, sir. We can take a couple questions if it's all right. I request the students, if you have any questions, you may ask sir now.
Yes, hi, please. Anything related to oral oncology, oral health, dentistry, or you can please ask me questions, how to cessate and...
Hi, sir.
Yes.
I have a question. So, why is it that cancer, when seen in younger people, it's more aggressive than compared to older people?
Cancer is, in short, if I can say, is bad luck. Completely bad luck. Because it can happen in anybody. But there is something called stimulus. Okay, for example, if you keep poking me here with a pin every day, for 2 years, I will develop a cancer here. So basically, cancer can be, defined as any abnormal growth, unregulated growth because of an abnormal stimuli, or when the how do I put it across to you in a very simple term? Well, anyways, a lesion which grows with or without stimuli. As in, if you poke also, it's becoming a cancer in a normal individual, and if you don't also, it turns. Okay, got it? So there are 2 types of genes in our body. One is tumor necrosis factor, and one is oncogenes. So basically, it's like police and mafia in our body. So there are tumor cells, there is cancer which is made up in our body every day. So similarly, TNF genes goes and it kills it. So it's like a police and mafia game in the body which is going on. But the day the mafia becomes strong, which is oncogenes have become strong, genes, I'm talking about genes. Oncogenes become strong, they overtake this TNF and they cause a specific cancer where there is genetic. So when a genetic mutation or a cancer is caused in an early stage, that means there is gene mutation happening in an early stage. For example, if you see a patient who's getting ovarian cancer, prostate cancer at the age of 60, 65, for example. So that is something probably they'll have that type of cancer only. But patients, for example, 18 years, 20 years, or leukemias, if they get a cancer, if they live off more than 5 years. So basically in cancer we have after cancer treatment we have 2 years, which is called as recurrent stage. If any cancer occurs within 2 years, it is called as cancer has recurred. 2 years. It is not like after 5 years it is recurred. Anything happening after 2 years, it is called as second time it has come. So people who are young, they still have a tendency to get cancer again in any other different part of the body. Taking treatment one time only takes a lot of toll. If the individual is caught up with another type of cancer, then it again takes on a new other level. And the disease is very aggressive in young patients. For example, I'll tell you, if a patient comes today, and if I see his tongue moving, and he comes after a week, I can't see his tongue moving. That means his disease is very aggressive. But in old patients, if the patient comes today, and I see his tongue moving, after a week if he comes, his tongue still is moving. So disease aggressiveness is more in younger generation when compared to adults. Hope that satisfies your question. Yes, please.
I wanted to know regarding the ads that the celebrities are giving, Bolo Zuba Kesari. So is it... Because recently I was in the Northeast, and then I find that every other individual there has a big lump either on the right or the left side of the cheek, and they say it is just supari, as you said. So it's quite alarming. And also for the youngs, if you can throw light a little on e-cigarettes and the hookah, because a lot of hookah bars are coming up, and we see a lot of youngsters being excited about visiting the hookah bars and being part of it. Yeah.
So basically, Vimal, so this is so unfortunate. 3 Padma Bhushan, they are giving advertisements for Vimal. That's so. So actually, previously, I don't know whether you know about this or not. If you I have seen it. I have not bought it, but if you're standing at a place where they are selling Vimal or any other flavor of gutka, Vimal is sold separately. Tobacco sachets are sold separately. It is not in one. That is why they can advertise about it. Any specific tobacco related or alcohol related, they cannot advertise. So basically, if you're seeing any advertisement which is related to any alcohol bottle, it will be sparkling water or water. But Vimal, if anybody goes and is buying Vimal, the person who is selling it will definitely automatically give a tobacco sachet with it. So basically, that is why the advertisement is allowed, and that's how they can do it. And the whole tobacco industry, the whole alcohol industry, everything, they say that out of 100, 10 are getting, 90 are not getting cancer. So that is how they are surviving in the market. That is where genes come into play, and cancer is bad luck. I can say an example of my own family, my grandfather, paternal and maternal side. But both of them used to smoke a lot, grandfathers. My paternal grandfather died because of lung cancer, smoking. My maternal grandfather, he died at the age of 92, but still smoking heavily. So I myself, being an oncologist, can say I have two examples in my family where one will say I got cancer because of smoking. My other grandfather said, Nana, aap smoke nahi karna. So he's like, the doctor who told me not to smoke is already dead. So basically we can't help. It's just about bad luck. Yeah, but the advertisement and all what we see is because they just marketing it as a flavor, whatever it is, not more than that. Yes. Anything? Anybody else? Thank you so much for giving me the opportunity. Thank you.
Sorry about that. Are there any more questions, or can we conclude the question and answer session? Okay, so there's one more question.
Can we have the session later on?
Yeah, please.
Because we are running out of time. You can say. As we are running out of time.
Excuse me, I'm so sorry. Can we have the question and answer session later outside, because we're running out of time? Thank you so much. We'll take your question as soon as the talk session is done. Thank you. We thank you, sir, for this very thought-provoking talk of yours. Thank you.
Welcome. Thank you.
Next, we have a talk by the doctors from Prameya Health Private Limited, located in Jayanagar, Bengaluru. I request Priya ma'am to come and welcome them. I request the team of doctors to come onto the stage. I heartily welcome the Prameya Health team, Dr. Sandhya Ravi, co-founder and managing director of Prameya Health Private Limited. Dr. Jyoti Menon, Senior Obstetrician, Gynecologist and Reproductive Health Specialist. Dr. Manasa B, Certified Ayurvedic Physician and Program Director at Prameya Health. And Dr. Trisha, a Naturopathic and Yoga Physician. I heartily welcome all of them.
I now request Parimala from 3rd year BSc to come and introduce the speakers.
Dr. Sandhya Ravi, the founder and managing director at Prameya Health, is a highly respected general surgeon and breast specialist with a rich clinical background and a deep commitment to holistic health. She has been a driving force in establishing an integrated wellness center that brings together modern and traditional systems of medicine under one roof. With a strong focus on women's health and cancer prevention, Dr. Sandhya Ravi champions a multidisciplinary approach to healing that includes surgical care, prevention, and patient empowerment. Her leadership has helped create innovative programs like Sahai, Reboot Your Life, supporting cancer patients during and post-treatment through functional, emotional, nutritional, and spiritual care. Dr. Sandhya Menon is a senior obstetrician, gynecologist, and reproductive health specialist with extensive experience in women's wellness. Her medical expertise spans across obstetrics, gynecology and fertility management. As a key member of the Prameya Health team, Dr. Jyoti Menon brings a patient-centric perspective to preventative health and wellness. Her work focuses on empowering women through education, clinical guidance, and reproductive health services that are compassionate and evidence-based. Dr. Manasa B is a wellness consultant and program director at Prameya Health, who is a certified Ayurvedic physician and a specialization in holistic wellness and integrative care. At Prameya Health, she designs and oversees wellness programs that blend the ancient wisdom of Ayurveda and modern health needs. Her work emphasizes the importance of balancing mind, body, and spirit, especially in the context of lifestyle diseases and cancer support. Dr. Manasa is passionate about natural healing, prevention, and sustainable health practices. Dr. Trisha is a naturopathic and yoga physician dedicated to promoting natural healing and mind-body wellness. With her foundation in naturopathy and therapeutic yoga, she supports patients in their journey towards holistic well-being. At Prameya Health, Dr. Trisha plays a vital role in implementing integrative therapies for cancer patients and individuals seeking preventive health care. Her approach focuses on harmonizing physical health with emotional and spiritual resilience through lifestyle modifications, diet, and yogic practices. I now invite the Prameya Health team for their talk on holistic approaches for prevention of cancer.
Good afternoon. I take this opportunity to thank the management of NMKRV Hospital for giving us this opportunity to address all of you on this very, very important topic of preventive health practices, especially in cancer. I thank the Department of Biotechnology and Microbiology and also this Bhavani Memorial educational program which has been running for several years on this very, very important topic this year. The previous speakers have spoken about two very important cancers, the oral cancer, breast and cervical cancer. we are going to speak on a holistic approach to prevention. So screening and treatment is one thing, but all of us know the most useful but least attended to adage. And what is that? What is that we don't follow? We know that saying, but we never follow it most of the times. What is that? Excellent. Prevention is better than cure. So especially in health, that is so important. It is useful in all walks of life, especially in health, it is so important that prevention is better than cure. And as we see science advancing, we are also seeing, people are more focused on diagnosis and treatment, but nobody is focused on prevention. And as a senior surgeon, a breast specialist for the last 40 years, sometime, in the second half of my career, it occurred to me that as a doctor, I am responsible for actually thinking about prevention, and why am I not doing something about it? And that was the reason why we as a group started Prameya. And Prameya its focus is on preventive and supportive care, which, as all of you know, is so important, right? And for that, we thought just sticking to one aspect of science, that is the modern medicine, is not enough. Because modern medicine, for all its fantastic progress, for all the help that it gives society with its excellent diagnostic techniques, excellent treatment options, is way, way, way behind when it comes to prevention. So we felt the need to integrate our rich cultural heritage, our rich heritage which we have with Ayurveda, yoga, etc., and bring together as a holistic approach, an integrated approach. And that's why today we have a wonderful team with us. I have Dr. Jyoti, Dr. Manasa and Dr. Trisha, and that's why we've come as a team to talk to you about it. Most of the things today in today's awareness programs have already been covered by the previous two speakers. There's bound to be an overlap, but what we are trying to focus is on the holistic preventive approach to cancer. So when we talk about prevention, just before we move on to that, I want to tell you a little bit about Prameya. I said it's a holistic, integrated, supportive care and preventive care center. We are located right here, just two roads away from NMKRV. And our main aim is to develop a healthy community. In fact, our tagline is developing healthy communities. And also we help people manage disease, prevent complications with just lifestyle changes. And we hope, doing all this, we can reduce the economic burden of disease. That's our team. It's a primarily women-led approach to this whole thing. And we also focus largely on women's health. So we have two programs, two flagship programs. One is the Sahai Cancer Support Program, and the second is Pranasakhi Women's Health Program. So the Women's Health Program primarily focuses on preventing illness. So please remember that. And remember what we are going to tell you today so that it can help you not go to doctors. So in fact, one of the other famous things that we tell patients is we tell patients how not to go to doctors. So coming to today's topic, the previous speaker spoke on cancer is just bad luck. So here we are coming to a discussion about fate and free will. Do we just say, I have a family history of cancer, so that's, my bad luck, and I expect to develop cancer? That is one way of looking at it. The second way is, we have a choice. We have a free will to make a change, right? Agree or not? Yes, we have a free will to make a change, and that is what we must work on if we need to prevent something. So what happens in cancer? You're all biotechnology students, microbiology students. Can anybody say what happens in cancer? You've also heard the previous speakers. What happens in cancer? Anybody? Rapid growth of cells. So why in our body we need cells to grow, right? Constantly our intestinal cells are changing, constantly our hair is growing, our nails are growing. There is rapid growth of cells. But what happens in cancer? There is a disobedient cell, right? So this cell is absolutely disobedient. It does not listen to the signals that are there in the body for growth or for death. All of you know that each cell has to grow to a particular extent and then die. Programmed cell death, what we call apoptosis. So that stops happening because the cell is disobedient. And how can we ensure that so that is an unhealthy cell basically, and that can keep growing and produce cancer. How can we help our cells to become healthy? How can we keep our cells healthy? So approximately we see that 80% of the cancers are linked to the environmental factors that we are subjected to. So basically we are at a crossroad today between our lifestyle, the public health and science, basically cancer prevention. Because more than 50% of the cancers are preventable. More than half of the cancers that we see. And the contributory factors are basically diet, our sedentary lifestyle, lack of physical activity and obesity. So the burden of cancer can be reduced if we make a social commitment to change. And having you all here listening to the Cancer Awareness Program topics today is one very, very positive thing that we note, that there is a commitment by at least your organization, to make this change. And we change our personal, individual behaviors as well. And of course we have the government policy makers, helping us achieve this. What is the most common cancer today? You've heard 2 lectures on this. So today, even though there's an overlap, we look at it as a unique opportunity to reiterate this important thing. So what is the most common cancer? In male? Excellent. In females? Oh, wonderful. So all of you have been listening. Excellent. So as we can see, the global cancer burden is increasing. Can I have a handheld mic? Thank you. And you can see that by the year 2040, we'll have nearly 27 million new cases across the globe every year. And as you rightly said, the most common cancer is lung in the male, and in the females it is breast. It has overtaken cervical cancer a few years ago. So when we look at the interaction between a normal cell, between the genetic factors and the environment on the normal cell, we're constantly being subjected to what is called carcinogens, the agents which initiate cancer. They can be biological agents because of certain viruses. We just heard about HPV virus, other bacteria and parasites. Chemical agents like asbestos, tobacco smoke we just heard about, aflatoxin and arsenic, and physical agents. So, but we could also have genetic factors which are causing cancer, but genes are not our destiny. So our lifestyle is what dictates it. So when you come to lifestyle and cancer, number 1, like you've heard this morning, is tobacco. 40%. Nearly close to 50%. 40% of the cancers are caused by tobacco. Diet accounts for 30%. Sex and reproduction and infection account for another 25%. Air pollution is only 4% and others is only 6%. So we go on harping about how polluted Bangalore is, why it's so dangerous to live here, etc. Yes, no doubt it causes a lot of other problems, but that's not the main cause for cancer. It is tobacco smoking, so all of you must be very, very aware of that. So we've already heard this about second-hand smoke, third-hand smoke, etc. And the dangers of also tobacco chewing, non-cigarette aspects of cancer. Just tobacco chewing equals 30 to 40 cigarettes per day if you're doing it continuously. So in addition, of course, all of you know that tobacco is harmful. You can have a heart attack, you can have vascular diseases, lung diseases, fertility. For you young women exposed, either who have started smoking, because we are in the preventive space, again we feel very sad to see very young girls sitting in coffee shops and things like that smoking. So please remember that it is going to affect your fertility, as you grow older and want to start a family, and also it will result in premature death of the baby. So at least for these things you must be very, very, I've heard girls say, oh, I'll take care of it. Cancer happens only in the elderly. I have another 40 years to go. But please remember that it has immediate side effects like these. So that is about tobacco. Then coming to diet and cancer, again, we've heard a lot this morning about the cancer-causing foods. There could be moldy foods. If you don't preserve food well, there could be mold, and that meat cooked at very high temperatures can generate heterocyclic amines, which are carcinogenic. The spoiled foods, and again, the most important thing is high protein foods. Nowadays, if you look at social media, you'll be seeing increase your protein intake. So we see a lot of youngsters going to the gym and taking artificial protein supplements. Too much of protein is also bad because it works along a pathway which actually creates more cancers. And of course, within our own body, we have poor metabolism. Many of you may be familiar with PCOD, right? Irregular periods, putting on weight, having a lot of acne, etc. So PCOD is also linked to insulin resistance. So too much of insulin. Insulin is required in the body for what? For what is insulin required? Glucose metabolism. So if it is all under control, then you have the right amount of insulin taking care of your sugar levels. But if it is impaired because of some metabolic reasons, you have what is called insulin resistance. And there's a lot of insulin floating around in the body, which is actually carcinogenic. It initiates inflammation and is a precursor for cancer. And of course, red meats, fats, sugar, alcohol, even dairy. So dairy has also been implicated in certain prostate and breast cancers. So we know that obesity itself is a cause for metabolic syndrome. Okay, so type 2 diabetes, hypertension, insulin resistance, your cholesterol levels going out of control, and also cancer. So obesity is the third most important cause for cancer, first being tobacco, second being poor diet, and the third is obesity. So there are many, many cancers associated with obesity, as you can see from this picture, from the brain to the colon, rectum, ovary, etc. And next is the infection, which we see, the human papilloma virus infection, which can cause cervical and oral cancer, also other cancers, the genital cancers. Hepatitis B and C, which is given for the prevention of jaundice, the vaccines, if you don't take it, and if you develop these infections in the body which causes jaundice and affects your liver, your chance of developing liver cancer goes up. And also the Epstein-Barr virus. You've heard of a certain kind of a blood cancer called a lymphoma, which affects youngsters as well as older people. And that could be because of a virus infection in the nasopharynx called the Epstein-Barr virus. That's about the infections causing cancer. And of course, inheritance. You've heard the previous speakers talk about genes, Angelina Jolie effect, etc. So some cancers could run in families. But you must remember that having a mother or sister with cancer increases your risk slightly, but it does not mean that you will definitely get cancer. Okay? So it's only 5 to 10% of cancers which are actually hereditary. Now we have, science has advanced that we have identified genes which can run in families. So if you are a carrier for a BRCA gene which is passed down from your mother, then the chance goes up slightly, but even then, it does not mean that 100% you will develop cancer in your lifetime, because you have a window of opportunity to take preventive health measures to address this. So when we talk of epigenetics, what does it mean? You're all science students. It means we're looking at the effect of the environment and your behavior on your DNA. It's not to say that your DNA will change. The sequence of your DNA will not change. But it will change how your body reads that DNA if you're living your life very well. So there are many things. Now a lot has been discovered about altered methylations, altered histones, the microRNA, etc. And the normal cells, because of all this, what the environment and our behavior does on these pathways, it can convert the normal cells to cancer cells. So they may work independently or in combination. You could have a genetic effect. But because you have the gene, if you take proper preventive health practices, you may never have a problem. But despite, if you don't know that you have a genetic problem, an inheritance, and lead a very, your behavioral lifestyle is very poor, then you could actually be triggering the occurrence of a cancer. So pollutants are everywhere. When we look around, it's there in the food we eat, the water we drink, the air we breathe, and also very, very important as women. How many of you read the labels of the shampoos or the soaps or the makeups that you use? Very good, quite a good number. And what are you looking at? Pardon? Parabens and phthalates. So one important thing as women you should know, because not only are you using them on yourself, you may be buying them for your house, to clean your house, the cleaning products, the dishwasher or the washing machine, soaps, etc., the house cleaning products. There are these very, very dangerous chemicals called endocrine disrupting chemicals, or EDC. And it's there all around us. Because we're so tempted to buy something which is there on TV, some beautiful advertisement or in a magazine or on Instagram or whatever. I mean, all of us are guilty of that immediately, and it's so easy to order now on Amazon, right? The minute you see, you order it. So it could contain a lot of harmful chemicals which mimic estrogen. How does it mimic estrogen? Every cell, especially in the breast ovary, has a receptor. So this endocrine disrupting chemical goes and sits on the receptor, so the cell thinks it's an estrogen molecule. And then what happens? It sends signals for it to behave. So those are the reasons why, if we stop, look around and think, why are we seeing so many PCODs? Why are we seeing so many women with, who are infertile, who have to go to an IVF center to have a child even as early as the late 20s? So why are we seeing so many cancers? Why is breast cancer rising so much? So probably the answer lies in our lifestyle, which we are compounding the effect of our genetic component as well. So we must be very, very aware of the products that we are using. So when it comes to prevention of breast cancer, there are modifiable, non-modifiable factors. Those which are not modifiable one is we are born as women. We can't change that, although we can within brackets. So we have born women, so our risk goes up. And as we age, our risk of cancer goes up. If we have a family history of cancer, then we are at greater risk. So these are things which are not in our control. But what is in our control? Early menarche, late menopause, HRT, obesity, all of this will be based on the lifestyle that we lead. So those things we can change. And so I'll just be running through these slides because Dr. Saldana, was it? Yeah, she spoke on those. So it's important that we know what is normal for us. And as women, you know that our breast undergoes changes from adolescence to menopause. So many of you would have experienced heaviness, pain, discomfort in the breast before your periods, which magically disappears once your period is done. So that is normal for you because the hormonal changes, the estrogen and the progesterone fluctuate through every menstrual cycle. There are other changes that you can look at. Breast is part of your body. I'm a breast surgeon for the last 40 years. Very sad to say, educated people, doctors themselves have never done a breast self-examination and come with large tumors. So breast is part of your body. Just as you spend time looking at your face, looking at the fitting of your clothes, please spend that time also looking at your breasts in the mirror to see if there are any changes. If one breast is larger than the other, that could be normal for you. Understand what is normal for you by looking at your breasts from time to time. And you should know what you should look and feel for. I'm sure all of you know that because some of you answer that question. You look for a lump, you look for a thickening, you look for any redness, you look for a nipple discharge. Having said all this, the minute you find it, don't go into a panic mode because 80% of the breast lumps are not cancer. Isn't that a fantastic thing to know? It's only the 10 to 15% which could be cancer and which we need to pay attention to. So today don't go and say if you find a lump, doctor said 80% are not cancer, so I don't need to do anything about it. The fact that you don't need to do anything about it has to come from your doctor. So if you find something abnormal, please go to the doctor, get it checked and let the doctor reassure you that no, this is only a fibroadenoma, you don't have to worry. This is only a cyst, you don't have to worry. Okay? So breast self-examination is regularly, periodically is what is going to tell us the nature of our breasts, which is normal for us. So this is how you do it. It is not rocket science. You don't have to say, I don't know. I have educated women coming telling me, I don't know how to do a breast self-examination. It's part of your body. Do it anyway. Just feel it all over and see if you can find anything abnormal and what is normal for you. It is best done when you're having a bath or you're lying down because then you don't have any restrictive clothing. Your hands move smoothly because you've soaped yourself and it works, helps you detect. So you should know this 5-point code. Although we've spoken about it earlier this morning, just to reiterate, you should know what is normal for you. You should know what changes to look for and feel. You should look and feel. Just knowing it in theory and not doing it in practice is useless, so you have to do it. And if you notice a change, please go to the doctor, see the doctor, let the doctor reassure you. And regular screening, breast screening after the age of 30 for everybody. If you have a family history, you will want to do it earlier. So 3 things as far as the breast is concerned: a mammography, a breast ultrasound, a clinical breast examination, and breast self-examination. So the first thing that you will do is what? Self-examination. And then if you find something abnormal, you'll go to the doctor. Doctor may ask you to get an ultrasound, a mammography or an MRI, depending on your risk, everything. You don't break your head about it. And then you will do the doctor will do a clinical examination and then ask for the mammogram or ultrasound. So, has anybody got a screening done here? Today I think they're doing screening, right? How many of you have got it done here? Nobody in this group? Okay. You will be getting it done. Okay. So it's not a scary procedure. Even when you do your breast self-examination, what we recommend is do it in a caring way. You're caring for your body. Don't do it in a scared way. Oh my gosh, am I going to find something? Do it in a caring way. It's part of your body. Say that you're caring for yourself and that's why you're doing your breast self-examination, and usually it goes well. So is there a schedule? We don't have a national screening program for breast cancer, okay? Unlike UK or US where they call people regularly. So what we do is an opportunistic screening. We ourselves go to the doctor and say, I would like to get myself tested. So we don't have a schedule from our government of India. But what we recommend is start going to the doctor from the age of 30. Okay? At least once a year, get yourself screened. Do a breast self-examination regularly. If you have a very strong family history of cancer, mother, sister, grandmother, etc., go to the doctor early, even from the age of 20. Your doctor will tell you how bad is your risk and how often you should get examined. And then, of course, every 3 years from the age of 20 to 39, and every year from the age of 30, you go to the doctor. From the age of 40, your doctor may say whether you need an imaging, either an ultrasound or a mammography or an MRI from the age of 40. Many times we ask for it only, depending on the risk factors and our findings, we ask for it only once in 2 years or 3 years. So now we come to the, again, reiteration but important topic of cervical cancer, and I asked Dr. Jyoti to just speak to us about it.
Thank you, Dr. Sandhya. Good afternoon to all of you. I'm sure this is a repetition of everything, but then it is a revision. So let us see how much you really heard when Dr. Smita Saldana spoke about all this. This is just the risk factors for cervical cancer, which has been discussed. I'll just go through it very quickly. Whenever there is more activity, sexual activity, either by early marriage or multiple sexual partners, we assume that the chances of having this kind of HPV infection and then later cervical cancer are more. When you have frequent childbirth, the chances of the cervix getting injured during the process of delivery are more. So that also makes it an increased risk factor for developing cervical cancer. Again, multiple sexual partners, because you have a higher incidence of getting a higher chance of getting HPV infection from one of them. And here I would just want to emphasize the poor genital hygiene. May not be so relevant to us here in cities, but definitely in the rural population. That is why cervical cancer still has a higher incidence in the rural population. Especially, I want to emphasize during menstrual cycles. How many of you all know about the menstrual cup? Good. Excellent. Both for you and for the environment. So, and that is a very good way of going ahead with it, because that to a large extent, it's very, very important that you take proper hygiene during your menstrual cycles, because blood, like all of you know, is a very, very, what shall I say, great harborer of infection if it is left alone. That is why using pads for a long time without changing, or using the cloth in this thing again from morning to evening, is going to get you make you have higher incidence of local infection, which can result in genital infection, cervical cancer. The other important thing I want to also tell you is, when all of us pass urine, do in a toilet, we sit down and pass urine, do you all wash yourselves after that? Okay. You wash yourself, we don't ask you to use, just water will do. And when you wash, is there a particular direction you must use? Can you tell me? Why do you think we are talking about direction? Very simple. Because you have, unfortunately as women, our urethral opening, vaginal opening and the rectal opening are all very close. So there is higher chance of, if you wash from back to front, you have a higher incidence of introducing infection from the rectal region into your vagina and into the urethra. So please remember, whenever you wash after you pass urine, you all will do it after you pass a stool. But when you pass urine, please wash from the front to the back. And if you're using a tissue to wipe yourself also or mop yourself dry, it's front to back. Please remember this, it's very important. This has already been covered. I'll just give you the frequency which this has been done. So you get routine pap tests, get the HPV vaccine, practice safe sex, quit smoking. This has been emphasized by everybody, including the previous two speakers, because tobacco causes a lot of cancers. So smoking, especially in the young girls nowadays, if you all can realize that this can lead into more number of problems, it's a good idea for you all to quit smoking and tell your friends also to do the same. So this is exactly how a pap smear is tested. It's a very simple outpatient procedure. It's not painful. Maybe now for you all it may look a little bit, it is a little uncomfortable but not painful. And it is done just like a pap smear. And it can be done at the same time when the pap smear is being done. but the swabs taken are too different, because for pap smear we're looking at abnormal cells, whereas in this just like what happened during the COVID time, the the infection, we are looking at the DNA virus of the human papilloma. So that the virus analysis happens in a different way. So the method of doing is the same, but the analysis is in two different ways. So when do you get screened? This is a little, 29 is a little late. 21 is quite a good time to start getting screening. And after the age of 30, it becomes very mandatory. And if you are going in for an HPV screening along with the pap smear, then it is recommended that you do it once in 5 years. But if you are doing only the pap smear, it has to be done up to the age of, every 3 years, up to the age of menopause. Post-menopause, it is dependent on your risk factors as well as what your particular gynecologist would tell you. Again, it is not 100% protective. So though you take the vaccines as recommended, and I would really like to tell you all, since Kidwai has offered through Dr. Smita Saldana about the vaccination, it is a good idea to get vaccinated. And if you are going to take that vaccine, to a large extent it will protect, but it does not give you 100% protection. What I want to emphasize is, even if you take that vaccine, you have to follow other things like for having safe sex as well as going for regular screening. So early detection, just very briefly, breast, cervix and oral. Other cancers which can also be detected early by various methods: prostate, ovary, lung and colon. Prostate, there's a particular blood test. Ovary, specifically, if you have a family history, then you need to go for an ultrasound much earlier than another person who would probably do it later. Lung, of course, the symptoms have been discussed. Colon, yes, there are certain factors, especially if you have repeated gut issues. Then you need to go and see a surgeon, gastroenterologist, to see if any further investigations need to be done. So these, for various cancers, these are specific. It comes as a mnemonic: caution, change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, either from the nipple or from the vagina or from the rectum, any of these. Thickening or lump in the breast, indigestion, obvious change in the size of any wart or mole, and nagging cough or hoarseness. This sort of covers all the gut cancer, lung cancer, cervical cancer. Most of the cancers, the common cancers, are covered in this. Like what has already been discussed, genes, yes, to some extent, but it is not our destiny. Like Dr. Sandhya had mentioned, we still have a chance, though we may be having the BRCA gene. If we do we understand that we have the risk factors, we know what our family history is, and we take the corrective lifestyle changes. To a large extent, we will be able to, if not prevent, at least diagnose early and have it at a much distinct stage then, if at all we didn't do anything about it regarding lifestyle changes. And again, which has been emphasized, 50% of the cancers can be prevented by lifestyle changes, whether it is nutrition, whether it is your activity, maintaining a particular body weight, or preventing obesity, and going for regular screening programs. This covers my talk, whatever I wanted to briefly tell you on cervical cancer. I want Dr. Sandhya to come back.
So 50% of the cancers can be prevented. We again go back to fate and free will. Just yesterday, there was this lady in her 30s who came to my clinic. She was diagnosed with cancer. She's undergoing treatment. She's had surgery. She's had chemotherapy. She's going to start her radiation. So when I was talking to her, she was treated elsewhere. She came to us for supportive care. So when I was going through the history with her, she said, "Doctor, I've been doing everything right all these years. I don't have a family history of cancer. I exercise regularly. I eat right. I have 2 children. I've breastfed both of them for 3 years. Where is my risk factor? How did I get it?" We have no answer to that. Despite science being so advanced, despite so much research being done. Like Dr. Mustafa said, luck. But luck can also be in your favor here because you've been doing everything right. This can just be a blip in your life, this cancer journey. Very likely she'll come out of it very well, achieve cure, become a stronger, more, productive person in terms of what she wants to do with her life. But then there's no way we can predict what happens when that one single rogue cell misbehaves. But if we've got our life and our act together in terms of leading a good, healthy lifestyle, then our chances of dealing with any situation, there's no way you can predict an accident, right? You may be an absolutely healthy person, you may be knocked down by a car or a bus, you may have multiple fractures, but then if your health basically is good, you bounce back. So that's how we have to look at it. So a lifestyle for cancer prevention, of course, there is no stopping tobacco and alcohol in our view, because we come from a preventive setup, is non-negotiable. There's no thing of occasional, once in a way with friends. No. There are you can get that high with other things. You don't have to resort to drugs, tobacco or alcohol for that high, right? You can have so many other beautiful activities in our world these days with friends and family which can give you that kick, which is if that is what you're seeking through tobacco, alcohol or drugs. So that is non-negotiable. There's no moderation. There is no once in a way. It is never. Okay? And having said that, diet, we have to make better food choices. We have to be physically active. We have to maintain a healthy weight, and we have to set SMART goals. All of you know that acronym SMART, right? What is it? You have to be specific, you have to have a measurable goal, you have to have an achievable goal, you should have a realistic goal and a timely goal. It can be as simple as going for a walk every day. It is specific, going for a walk. It is measurable, I will walk for 30 minutes. Okay? And you are doing it every day, you can tick off on your calendar. It is achievable, it is simple, it is realistic, and it is timely. So set simple goals in your life which you will incrementally achieve, increase day by day, and you will make yourself a better person. So we said diet, right? Don't eat this, don't eat that. What are you supposed to eat for cancer prevention? You have to have these food items. What we recommend is predominantly whole food, plant-based diet. Okay, if you're a non-vegetarian and you think it's very, very difficult to give up non-vegetarian food, make healthy choices. Don't go for processed non-vegetarian food. Make it from scratch. Choose lean meat, choose fish, healthy fish, etc. But predominantly plant-based is what is going to protect us. A lot of research is being done in this area which is showing that it prevents inflammation. So we have folic acid, antioxidants, phytochemicals, all of that which come from this low-fat plant-based diet. We have phytonutrients from the fruits and vegetables category which prevents this disobedient cell. It actually smacks it on the head and says, behave properly. Listen to the signals in the body. So that's what a whole food plant-based diet does. So that's one thing you can try switching to. Second is benefit of exercise. So all of us know, we've constantly seeing walk for 150 minutes, exercise for 150 minutes a week, etc., whatever. Just do it. Like the Nike ad says, don't think about complicated things and say, I don't have time for this, I don't. Build exercise into your daily routine, because you'll find that your PCOD gets better because your estrogen levels and growth factors, all of them come into normal range. Your insulin levels get better, your inflammation is reduced, your immune function improves, and your colon is kept healthy because you exercise. And of course, the side effect or the good side effect of all of this is your weight is also healthy. And when we exercise, recent research has shown that there are myokines which are produced by the muscles, and they have a very protective, healing and a regenerative role. So multiple diseases, starting from the worst, that is cancer, to insulin resistance, heart disease, atherosclerosis, Parkinson's and other dementia, etc., is prevented. So exercise is a must. Diet, exercise. So what are the overall recommendations before I conclude is that one is, of course, like Dr. Jyoti was also mentioning, and I have also said about breast, get yourself screened regularly by knowing what is your risk factor. Today, when you have a dinner time conversation with your mother or grandmother or aunts, when you have family gatherings, is a good time to know your risk. Who had what disease? In addition to the usual family gossip, you please find out your risk also from the family, so that it will help you to get screened regularly. And of course, the whole gamut of things. Don't use supplements unnecessarily. Limit or avoid. I would say avoid alcohol, avoid too many sugary, sweet things. Somebody was talking, I think the previous speaker said, black is bad for smoke. And we also hear white is bad. Maida, dairy, processed foods, etc. We'll try to avoid all of that. So this, we hope broadly we've covered in terms of cancer risk and what we should do to lead healthy lives and just get ourselves screened. We just have Dr. Trisha and Dr. Manasa to talk to you about a few more points before we conclude.
So do you all believe there are manual procedures that can drain your lymph? So do you all know there are lymph nodes in our bodies, right? So one major thing that you're supposed to do, a practice that can be followed, is lymphatic drainage method. I'm just going to give you a gist on how you do the lymphatic drainage method. Comparatively, the major reason of why we are doing this is improving the circulation as well. So this is a procedure, something that you don't, of course it also helps with the lymphatic drainage, but also it helps you all to keep you fresh and awake. Like, you've been sitting in the session since 10:30 or so. So all of us are already half dosed, waiting for when we're going to have our lunch and stuff. So what do we do to wake ourselves up? Clap your hands. Harder, fast. The maximum force that you can give. Relax. So now look at your hands. Does that turn pink? What happened? Did you break your capillaries or what? You increased your circulation. Why? Because your hand has got the connection to all your organs. By any chance have you read about it? So that when you have a headache and somebody comes and says you press this point, you're having a back pain, press this point. Why do they say that? Does your organ stay there? Does your head stay here? So why? Because your hands are related to the entire system of your body, your hand and your foot. So somewhere down the line, just clapping your hands. For example, you're sleepy and you have to study, you have an exam coming up. Get up and just clap your hands. So what happens? It improves the circulation. Same way, there's another method called as tapping. So this aids with your lymphatic drainage. So how do you do that? You take your 4 fingers and you just slightly tap all over your shoulders and come up to your chest region. This is a method for tapping. How much pressure do you give? Not like how you hit her sometime back when I saw it was too loud. Not that much amount of pressure, okay? So it's going to be the level of minimal pressure that you're gonna give along. So tap, you only move your wrist region. It's not your entire hand that moves, it's just a wrist movement that you give and you take it up towards your chest region. So this drains your lymph. Same way along your other hand as well. So just tap it and bring it on top, okay? And there are few pressure points that also aids with the lymphatic drainage, just in the front and the back of your ears. So you can see a small dip behind and same way in the front. So take 2 fingers this way and just minimal pressure, just give a rotatory motion. All of us are not that difficult to take your hands and do it while you're doing it right now. So take it. So if you have any doubts, we are here to clear it right away. So take your hands and just give a little bit of rotatory motion and just drain it downward. That's it. Okay? And the next one is you take your hands, both your fingers, cross it like this and place it just in the dip. You can see your collarbone, where all of us would like to say women should have a collarbone, right? So just above the collarbone, give a circulatory motion there as well. Maybe you can do it for like 5 counts or so and not more. Okay, so these are few pressure points that will also aid with the lymphatic drainage. So what and all did we learn now? First, clapping doesn't just have to do now, you can do it at any point of your time. Okay? Second, good. All the way to your chest. Fine? Third, yes, front and back of your ears. Fourth, good. Clear? So of course, when we see people and then we all of us want to be healthy. All of us don't want any diseases, and that's why we are here trying to get the awareness on how to stay healthy. When we look at models, when we look at when we scroll through Instagram, and we are used to that, right? We look at somebody and then be like, oh my God, look at how beautiful she is. She's got flat tummy and then there's no pimples on the face. So looking at a model, that's not what exactly means that you're healthy. We have a different model out here. Check whether you tick your box in that model that we have Dr. Mansa coming up and talking to you all. Because if you have a tick in there, that says that you're healthy. Okay? Thank you.
A very good afternoon, everyone. I have certain questions. So how many of you still play outdoor, or indoor, any sport or cricket? Great. How many were you playing before your 10th standard? Excellent. And how many of you are continuing your hobbies like dancing or singing with the same intensity that how you perceived in your school? Why? Actually, why are we banging and continuously talking about awareness, prevention and health to you people where you are so healthy and fit, right? Why? No, they are very young and energetic, they can flex, they can bend, they don't have any issues to squat down, to climb stairs, to run, jump. But why are we addressing you instead of addressing some 40 or 50-year-old? Why are we addressing you? Exactly, because one day you will be there and we don't want you to end up in some health issues. And this is a beautiful window where you are blessed with a lot of energy if you make your mind a lot of time, and definitely the good window, because when we talk about health, post 30 it's always the downward trend where your muscle mass will come down, where your bone strength will come down and your metabolism will come down. So most of every science says one thing: prevention is better than cure. Sastasya swasya rakshanam. You have to take care, you have to preserve what you have. But unfortunately the kind of lifestyle we have, till 5th to 10th standard, you will be running to 4 or 5 classes every day. This class, swimming, badminton, Bharatanatyam, singing. But once you enter the 10th zone or the 11th and 12th grade, all of a sudden there is a pause for physical activity. All your hobbies and emotional activities. And you are kind of reduced your physical activity, and slowly you are so stressed, worked up about your exams, and slowly that comes in form of weight gain, hair loss, change in the skin texture, which you are not happy, but it will go off because you are on a beautiful phase. But when a thing happens on a repeated fashion, as the previous speaker spoke and mentioned, when you prick yourself continuously at one place, it can give rise to cancer. Similarly, one day of stress, one day night out, one day chilling out with friends, eating one day junk definitely will not impact on your health. But when you do it constantly, mindlessly and unreasonably, definitely you will have certain health issues. And definitely it depends on the risk factors, how much you have. Our focus and aim is just to build the healthy communities where we want you people to develop certain simple daily habits where you build every day in a small manner, like 5 minutes in a day for a physical activity, 5 minutes in a day for your mental health. Because how many of you are on Insta? Okay, how many of you follow the health coaches or nutrition, fitness, gyan, etc., etc.? So many say, do this for 21 days, this will get better. Eat this for 3 weeks, then you'll not have this issue. Do you think all those things work? Why? Each person is different. You have to figure out what suits for you. And also it's confusing. Many just talk about the physical activity and many say managing your stress is important. It's all about emotional health. And some say, no, just you focus on this food, that's enough. But we are not independent of individual thing. We are composed of a lot of things. That's why we believe in holistic approach, and we have one simple mantra which is called the FENS model, where F is the functional or the physical aspects of your body. How energetic do you feel? Do you have the energy to come to class? It's not happy Monday. How many of you have Monday blues? And how do you overcome it? Compulsory attendance, so that pushes your blue away, is it? Or meeting your friends, or just you want to update on what you did on your weekend. Okay, so this is one thing where you can work on your overall health, which we call as FENS model, where F is the physical or the functional health, your energy levels, how fit you are. It's not about whether you're fat or lean, but definitely our ideal BMI is important, but being fit is important. So incorporate some physical activity in your routine. It can be playing your favorite sport, or it can be some dancing, whatever it is. But being physically active is important. You are sitting from 10:30 or more than that. It's a new poison. It's bad than smoking. So please stand up. But I have to ask you all to sit again, because I am going to talk for another few minutes. Okay, and so physical health or the functional health is important. At your age, you don't get the blood test done, but when you might have seen your parents, they would talking, my HDL is little low, my bad cholesterol is little high, those kind of things. If you don't want to fall into that circle, exercise. Exercise is very important, irrespective of your physical activity. It doesn't matter whether you're walking from your home to bus stand or from the bus stand to college. Having some sport or physical activity is very important, and you are in a beautiful age group where you can build your muscle mass. And when it comes to your hobbies, because now everybody is aware, whether it's cancer or diabetes or PCOS, the first thing you're told, you have a lot of stress. Work on your stress. The life is so you can't get rid of your stress level. What you can do is develop some skills to manage those stress. Simple breathing practice or some hobby like drawing or painting or singing, anything will be of your rescue. So improve your skill, because everyone was telling we are women, unfortunately or fortunately, I don't know, but when you grow, your roles will multiply. It's always multiplied, because you will be marrying someone, you have 2 families, then you'll be working, you have to balance home, everything. So the stress will definitely increase exponentially. You have to equip yourself. And the most happening thing on the Insta or whatever and every social media is the food. Everyone talks about this is good, this is bad, eat this, don't eat this. It's quite confusing. 10-20 years back they said this is the best food for this, and now they say don't even touch it if you have this disease. So at Prameya we believe there is one simple mantra to go about the food. First basic thing, moderation. Don't do anything in excess. Once in a way, as I said before, eating with your friends out, some junk is okay, but don't do it on regular basis. How many of you get dabba from home and put it aside and go for canteen? I don't know your parents, it's okay, you can be open about it. Home cooked foods are best. I know it doesn't taste great in your dabba. You might have a lot of complaints about it. But trust me, when you grow up, you would really realize how it is important to have a home cooked fresh food. except if you are in hostel for some reason. Okay, moderation is very important. How much we eat is also very important. Oh, it's a buffet, I have to get into that paisa vasool mode, I have to get back my money, I ate this. Don't get into that mode. So listen to your body, listen to your appetite. Listening to your appetite is important. So judge yourself, and portion control makes a lot of difference. And as Dr. Sandhya Ravi mentioned, more of plant-based, minimally processed is always good for health. And at your age, if I say be spiritual, don't think I'm not even 20 or 25 to say or chant some God name. When we say spiritual, it's not about being religious or going to temple. It's knowing yourself better. It's kind of acceptance. You know you have to come to college on Monday. It's a mandatory attendance, so you don't have to crib much about it, right? It becomes easier, right? Doesn't it? So acceptance makes things easier. So the more you accept, the more you connect yourself with the universe. We are all part of one universe. We are not different from the plant or the animal. So when we realize that, things becomes easier. And these habits will help you on a longer run to prevent whether it is cancer or diabetes or PCOS or any of the non-communicable list of diseases that you mentioned. Because health, when we say being healthy, is being healthy. It's not that you have to just prevent cancer, you have to just prevent diabetes, or you have to just prevent blood pressure. But why we spoke so much about cancer is because when someone is diagnosed with cancer, it's too draining, not just for that person, even for the family. It's a financial burden, it's an emotional burden, and it's a physical burden. A lot of things happens. Probably if someone would have seen their closer one going through it, they know the pain of it. That's why so much of emphasis is made about preventing cancer, as the cure is still question mark on the way. We are exploring it. Before I would conclude, I want to say we run a supportive care program for cancer patients. It's called Sahai Reboot Your Life. Why we are telling it to you is, if you come across any cancer patient, please refer them to this program. This program we run at free of cost, where we help them with the emotional counseling. We tell them what kind of exercise they can do. We tell them how they have to take care of their lifestyle. Even for their caregivers, we provide support. If you come across any cancer patient, please put a word across them, because it's a holistic and multidisciplinary approach and at free of cost. So just remember, what you are doing today is for your tomorrow, not immediate tomorrow. After 15-20 years, you would realize that if you do things right today, you will be better. Your lecturers would have told, just do it right, read so that you have a better career. Your parents would say, settle down soon so that your next life is better. So as doctors, we say, take care of your life and manage your lifestyle now so that you are healthier in your older age, and you don't have to take the support of a walking stick or some other person, which will limit your quality of life. Prevention is really always better than cure. So manage your physical stress better. Sleep well. Don't look into your phone once you go to bed, hiding from your parents or turning off the light. Limit your screen time. Manage your stress level well. And there are certain risk factors which were spoken again and again today. So please give some thought about it and plan your lifestyle and life plans according to it. Good luck. Thank you. Last thing, all your lectures ends with exam, right? Even ours. This is a small quiz. You can just scan the QR code and fill the quiz. And also, many of you said, most of you people are on Insta. We would be happy if you can follow us on our social media handle. We are placed as Prameya Health. Questions?
We can do it later. Yeah, and we will let you know who answered microbiology to the Dr. P or something.
Okay.
Sure. Thank you.
Girls, as you've scanned the QR, we'll be closing this session. You can fill the quiz later on. Please save the tabs on your browsers. Can we conclude? Thank you. We are grateful for the enriching and eye-opening session. Thank you. I now invite Dr. Aruna Nair of Department PG Biotechnology.
We can thank them and then we can That's fine.
So I believe all of us have learned methods to clear out our lymphatic system, drain it out. Practice it every day and we'll all be healthy soon. I now invite Dr. Aruna Nair to deliver the vote of thanks.
Good afternoon, everyone. As we come to the close of this important and inspiring program, it is my honor to deliver the vote of thanks on behalf of NMKRV College for Women, the Department of Biotechnology and Microbiology, and the Department of PG Biotechnology. First and foremost, I would like to express my sincere gratitude to Rashtriya Shikshana Samiti Trust for providing us with the infrastructure, vision, and encouragement that continually empower us to serve our community through education and outreach. I also extend my heartfelt thanks to our guiding light, our principal, Dr. Snehalata G. Nadigar, for her unwavering support, belief in this initiative, and constant encouragement at every stage of planning and execution. A very special thank you goes to the Kidwai Memorial Institute of Technology, Oncology, for partnering with us in this outreach. I am particularly grateful to Dr. Mahantesh and Mr. Bhima Reddy, whose tireless coordination and support from the Kidwai and ensured the smooth execution of today's screening camp. I wholeheartedly thank all the doctors and their support staff from Kidwai who have been with us throughout the day, offering their time, expertise, and care. Your contribution has been invaluable and deeply appreciated by every woman who walked through our doors today. We are all also grateful to our esteemed speakers, Dr. Smita Carol Saldana and Dr. Mustafa, for sharing your knowledge and insights during the awareness session. Your presence elevated the program and helped spread crucial information that could save lives. And Dr. Sandhya Ravi and her team from Prameya Health Private Limited, thank you for bringing a compassionate, integrative perspective to cancer care. Your holistic approach offers hope and healing beyond the conventional. I gratefully acknowledge the donors of the Bhavani Memorial Endowment Fund for funding and supporting this alumni-driven initiative, which continues to bridge education and social responsibility. I express my deep gratitude towards my colleagues, Professor Priya, Professor Suman Prasad, Professor Bhamamani, Professor Nalina, Professor Samson, Dr. Mrinalini B.R., Dr. Vinita Balasubramania, and Professor Tanaya Nayak for their relentless support in organizing this event. I also thank our non-teaching staff, Mr. Ravishankar, Mrs. Shashikala, Mr. Shivkumar, and Mrs. Prema for their support. I thank Mr. Chandrasekhar, the technician at Mangala Mantapa, for his technical support. And I thank our college canteen team for providing us with refreshment and food. A huge thank you to our student volunteers whose dedication, energy, and tireless efforts behind the scenes ensured that every detail was taken care of. You have truly been the backbone of this event. And finally, to our participants and audience, thank you for being here, for engaging and for making health a priority. Your involvement makes these efforts meaningful. Let us leave here not only informed but inspired to share what we have learned, to care more deeply and to act more bravely. Thank you and have a wonderful day ahead. There is a small announcement by the Department of Botany. Please stay.
Good afternoon to everyone. The Department of Botany is pleased to announce a special lecture on temperature sensitivity of photosynthesis in tropical forests, insights from the Amazon, Western Ghats and Puerto Rico. The session will be delivered by an international speaker, Dr. Rakesh Tiwari, Wennergren Fellow from the University of Uppsala, Sweden. The lecture will take place tomorrow afternoon 2 p.m. in Mantapa Auditorium and is specially organized for students of fundamental and life sciences. We encourage all the students and faculty members to attend and make the most of this enriching academic opportunity. Thank you.
Thank you, ma'am. I now request all the girls to stay. Please stand up for the national anthem. After this, you may all leave. So please stand up.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंग विंध्य हिमाचल यमुना गंगा उज्ज्वल जलधि तरंग तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Jai Hind. Okay, thank you girls. You may all leave now.